Good day, ma'am. So today we will discuss the chapter 15, urinary system. So, what the urinary system does. Urinary system, it removes waste and extra water from the body. It filters blood and makes urine to keep the body healthy and balanced. It also controls how much water and important chemicals stay in your body. The four main organs of the urinary system. First is the kidney. Second, ureters, urinary bladder, and the last is the urethra. First is the kidney. About the kidneys, they look like beans and there are two of them. They sit at the back of your tummy or abdomen, and their job is to filter waste and extra water out of the blood to make urine. Next is the location of the kidneys. So, they lie against the back wall of the body. They are level with your lower ribs and upper spine. The right one is a little lower than the left, and each has a tube, blood vessels, and nerves attached, and a small gland sits on the top. Coverings of the kidneys. So, the kidneys have coverings to keep them safe. First is the renal capsule. Renal capsule, a thin skin directly around the kidney. An adipose capsule, a layer of fat that cushions them and hold them in place. Function of the kidneys. So, the job of the kidneys is filter the blood, take out waste, and keep the right amount of water and minerals. It also helps control blood pressure and make hormones that help create red blood cells. Region of the kidney. So first is the renal cortex, the outer layer, and renal medulla. The renal medulla is the inner part just below the outer layer. And the last is the renal pelvis, the center part that collects urine and sends it to the tube.
This is my report. First, we got the medullary pyramids. Medullary pyramids are triangular regions of tissues in the medulla. Next is the renal columns. These are the extension of cortex, like materia inward. And lastly is the calicites, a cup-shaped structures that funnel urine towards the renal pelvis. Blood flow in the kidneys. First is the aorta. Next is the renal artery. Then is the segmental artery. Next then is the lobar artery. Then the interlobar artery. And next is the arcuate artery. Then the interlobular artery.